Arthroscopy of the shoulder or the elbow is a procedure that is done to look inside the joint. And here we have a 3D model of the shoulder. What the goal of arthroscopy is to perform a minimally invasive procedure and access the joint through minimal surgical trauma. As you see here, the joint space is pretty small. It's a few millimeters. So if I take this humerus out, you will see that the structure of the socket, which is called the glenoid. But once I have the humerus in place, it's very difficult to evaluate the articular surfaces, the ligaments, or the structures of the shoulder with the ball in place. Now, looking here in the background, we have an arthroscope, and what the arthroscope is a surgical instrument that has at the tip of the instrument a small camera. So the camera is actually right in here, and it's usually a 70 or a 30 degree camera that has at the end. What we do with the arthroscope is that we look through fiber optics on a monitor, and the saline solution runs inside this tube to improve visualization. So through minimally invasive surgery and by performing a small incision on the skin of the shoulder, and here we have the bone model, we can insert the arthroscope inside the shoulder. So here we're going to demonstrate in this animation how this is done. This is the back of the shoulder, and this is the front of the shoulder. The arthroscope is inserted in the shoulder joint, as you see here, from the back of the shoulder. And we can see on a monitor the structure of the shoulder joint. Usually the magnification is 6 times, so we have a better visualization compared to open surgery. We can do the same thing from the front of the shoulder by making a small incision here in the front or on the side, depending on the procedure that we do, and we put the surgical instruments from the front. So we can see our surgical instrument within the joint, and we can perform surgery through small incisions. That decreases the chances of infection and also minimizes the surgical trauma and the associated pain.